Darkcast Network. Welcome to the dark side of podcasts.
Imagine trusting a nursing home or rehab to care for your loved one, only to find out they've been harmed in the place that's supposed to protect them. What if a simple camera could have stopped it all? Today, we're diving into a story of heartbreak, resilience, and a fight for justice that could save lives and jobs.
You have a loved one in an assisted living facility or a nursing home. If you're thinking about having one, then you're going to want to listen to this week's episode. This week, I have guest Stephanie Sifrit, who is a senior citizen advocate who is advocating on the case of her mother. Stephanie, welcome.
Thank you very much.
So this touches my heart as well. My dad was actually just diagnosed with Lewy body dementia. So I understand the impact that this can do to a family, and especially when you have to put the care of your loved one in somebody else's hands, which is very hard.
Yeah, you've said it. It's hard. It's
Yes.
awful. It's awful.
And unfortunately, your mother has been abused in the home that she's at in Florida, in a nursing home, correct?
Yes, but what had happened was she was about 8 years into the dementia disease, and she didn't know us. We didn't understand the level to which she didn't know us until one night when I took the garbage out with my husband. And I had bought a condo so that I could actually live with my parents. And I took the garbage out one night and came back in. So 2 minutes, I was gone. And my mom walked up to me enthusiastically with this bright smile on her face and said, "Honey, I know I'm supposed to know who you are, but who am I?" So my mother didn't even know who she was. So one day, it was actually a Super Bowl Sunday, we had my family, my husband, me, my 2 daughters, and my parents in the house. We were going to have a Super Bowl Sunday thing for my dad because he was still sane. But she would run away occasionally because she didn't know us and she felt like she was being kidnapped. And so she went into another condo, just pushed her way in and was on the living room floor. And we had to call the police to come help get her. She wouldn't listen to us. So she would only listen to the police. And I took her to the hospital to give her evaluation, medication, to make sure her thyroid medicine was good because things can mess up your psyche medicine-wise. And so she was there for a few days and they wanted her to go to a rehab facility. So she had never been in a nursing home and it was never going to be our intention to have her in a nursing home. So we agreed to a rehab facility for 3 weeks. When she had been there 3 to 4 days, we got a phone call that she had reported to them in the morning that she had fallen during the night and that she had bruises on her lap and upper thigh. Because it was in 2021, the facility was still practicing COVID protocol. So when a patient is admitted into a nursing home, they go into isolation and quarantine for 2 weeks, minimum 14 days without question. So we were able to go see her after she'd been there for a week. This was after they had called and said she had reported falling. So I saw the bruises on her head, her shoulder, her elbow, her wrist, and her hand, and her thumb was hurt. It didn't dawn on me to look in her private areas. Just didn't, my mom's 85 years old. I'm not going to say, let me see your private areas. So I saw, okay, and they reported it. She was fine. She was talking to us, but she wanted out of there badly. And that was it. So we took the time to have a respite break, which if you've got a lot of family support for yourself, you're going to need it. But occasionally you just need to kind of walk away from the insanity because unfortunately that's what it is. And get your insanity back. So anyway, we picked her up in 23 days time. She was only there 23 days. brought her home, fed her, gave her a bath or a shower. And that's when I noticed that the bruising was not simple bruising. You could tell what had happened. I don't know how graphic you want me to be. I will be very graphic on your podcast if you want, but you need to give me the go ahead and the approval. I'll hold it modest until you give me the approval.
I mean, as comfortable as you are willing to go, absolutely.
I don't know who your audience is, so, So she had bruises that were hip bone to hip bone up to the belly button. And you could see on her pelvic area that the bruising was underneath a pull-up, a diaper. You could see the imprint on her skin from the diaper. The crotch was eggplant color. You could tell from the injuries, he put her over the footboard of the bed and hammered her. So my mother's body was used by a stranger. When we found this out, I took her to the doctor the next day after I showered her. The doctor said, call police, file a rape report, which we did. We went to the emergency room, and my poor mother, sitting in the emergency room on the table with doctors and a SANE nurse, that's a sexual assault nurse examiner. Her question was, did something happen to me? Am I okay? So I had to tell her, well, yeah, we think someone might have hurt you, but we got to check it out. And that was fine. So because of the way the facility handled the crime, where they reported to us that she had self-reported a fall hours later, and then 13 days had gone by since that man had done what he had done, the DNA was gone. So the DNA, there will never be a person held accountable for it. The scary thing, he's still working somewhere because he's never held accountable. Before mother even got to that rehab facility, I called them 3 times and told them she had never been in a facility. We never want her in the facility, and we are desperate to have our eyes on her to protect her. And I asked them 3 times to let me install a camera, to which they said no. It would invade the employee's right to privacy. This was 2021. So I called an attorney and said, why can't I install a camera? They said, it's the facility's rules because there's no law for it or against it. So the facility can say no. And that's what they did. So the rapist will never be held accountable. Through detective investigation, they are confident that they know who it is. And because when they interviewed everybody in the facility, only one man said, when they asked him if he raped my mother, he said, quote, unquote, or quote, the nurse doesn't love me, end quote.
What kind of response is that?
That is telling me that the nurse didn't want to give him what he wanted, so he took it from my mother.
Wow.
And the detective told us, we are very confident that this is the guy. I know his name. I know his birth date. I know where he's from. I know his address and phone number, but I can never do anything about it because he's never going to be held accountable.
Have they asked other residents if things like this are happening to them?
Yes. There was 2 people before my mother and 1 after my mother.
Wow.
Yeah. And the two before my mother, 1 could communicate. She had had a stroke, so she couldn't talk, but she could point and moan and groan. And when somebody came into the room, she pointed to her private, and she pointed to the person that had just left, which was him, and just kept pointing. And the guys asked her, the person asked her, somebody, it was in the report, said, did somebody hurt you? And she just kept pointing to her private. So 2 people before my mother and 1 person after my mother.
and nothing's happened.
No, because there's no DNA. So when there's no DNA, you don't know who to hold accountable. So in the interim, of course, the facility filed bankruptcy and sold out.
Wow. I am so sorry to even hear that. It takes a special kind of person to prey on people who cannot fight back. And it just goes to show you just how low of a person you have to be. And it's obviously a control thing. Let's go deeper than that. And I wonder if he's a predator on the streets as well.
I've checked his Facebook out. He's got a family. He has a child. I don't know. I don't know. I've got to leave it in God's hands. And then just be kind to him and let God pile on the gold, because I know God will take care of it. I'll never have any.
Right.
The only closure that I can have from this crime is that there become a law in the state of Florida that gives families the undeniable right to install a camera, so that no facility can say, no, you can't. And that's what I'm doing today for the last 4 years now. I've been trying to push Florida legislators to adopt a law that gives patients and families and healthcare surrogates the undeniable right to install a camera, so that people like him, if they see the camera, they might think, not this person. We can't with this person because he's got a camera on her. Maybe. Who knows? I don't know. The crime will never be completely solved, but the police were confident that they knew who it was, based on his answer. So
I watched your video on TikTok about your impact statement, I guess you would say. And you made some great points that I never even thought about. Like, that was your mother's residence. They work for your mother. So if you owned your own home, you would have the right to have cameras in there. So why, if that's supposed to be your space, your everything, you're paying them to be there to be taken care of, then why can't you have cameras there?
that's the problem. That is the very problem. And a lot of nursing homes do allow cameras. And then the administrators in the last 3 years that I've actually walked into their office, sat down and talked to them face to face, because I knew they allowed cameras. And I asked them, why do you allow cameras? And it advocates for the employee, because the patients, then you'll come up with some false accusations because they don't know what reality is. And if the employee is accused of doing something the employee is adamant that they didn't do, and it was behind closed doors in their resident room, the employee can say, look, the family's got video. Look at that day. Look at that time. Look, I didn't do it. And then maybe they'll see. And that happened with someone I know, where they could actually see, they thought one thing had happened. Then they looked at the camera and saw that the man had actually fallen. And nobody had touched him. He fell all by himself in his room. And it cleared the employee of wrongdoing. So
it works both ways. Yeah, absolutely.
I don't know why the legislators are refusing to sponsor Senate Bill 64 this year. It's been Senate Bill number whatever. They'd had a House bill a few years ago, but the Senate and the representatives have never, ever been able to agree we need to protect vulnerable people in this state. They just don't. They leave it in the control of the facility.
That's a crapshoot.
No, it's really sad, because and as I've gone through this process of putting things into writing, and even in the last 2 weeks, there's really 4 boilerplate pushbacks they keep giving me. Is it okay if I discuss that with you, and the boilerplate pushbacks? So with the legislators, their number one boilerplate, it's almost like they pass a little paper. Hey, here's what you're going to say if she comes to you. Here's what you're going to say if she comes to you. Because everybody I walked into their office on Capitol Hill in Tallahassee gave me the same answers. So they had the conversation, and they all have the boilerplate response. So there's 4 boilerplate responses. Sometimes I've said 2, sometimes I've said 3, and it just dawned on me that there's a 4th. The first one is that the camera is an invasion of the employee's right to privacy. Well, you clearly pointed out my counter argument to that one. the employee walks into that building, and everywhere in that building is their job. The only place that they can have a right to privacy is in the bathroom for the employees. Because in nursing homes, hospitals, all kinds of places like that, it's a policy that employees cannot just go in and use the bathroom of a resident. So you just can't go number one and number two in someone's nearest room just because you want to. There's no right to privacy because the room doesn't belong to the employee. It belongs to the patient or the resident. The second pushback that I keep getting is that it's an invasion of the patient's right to privacy. I'm going to give you that one. But I'm also going to ask you to poll the world population. And I want you to give them two choices. Forfeit your privacy in your late and vulnerable ages where people watch you live life. Or look at them neglected, abused, or raped, or sodomized. Be a choice. I don't know. Do you care if we see you peeing on the toilet? You can see me peeing on the toilet. You want to see me living life privately? Go ahead, watch me. But don't let another person use my body, and don't let somebody else hurt me. The third pushback is that what if the video footage gets posted online? Plausible. It's entirely plausible. It is an argument. We also have other cameras that are in use around the world where that same scenario could be applied, AKA Ring cameras and baby monitors. Perhaps we need to get rid of the baby monitors too. The footage can get posted online where your child is being trained and bathed. We don't want that, so get rid of your baby monitors too. So my question with the legislators on that one is, are you going to live by hypotheticals or are you going to live by evidence? And according to a government website, Crimes Against the Elderly, the average is 5 in 1,000 of crimes against the elderly that get reported. People aren't going to post videos online just to watch old people live life. It is plausible, but that's a hypothetical. It's a hypothetical. It's not evidenced. And then the fourth pushback is that allowing a camera law will open up a can of worms for lawsuits. That end dropped my jaw. If they are saying that too many cameras are going to offer too many lawsuits, something that is wrong. And something needs to be reset. Because that's ridiculous that they're saying, oh man, this is going to open up a whole can of worms of lawsuits.
Then that means there's a lot of issues.
It's my problem. And our legislators are saying these things to my face, not via email, not on a phone call. I'm in their office on Capitol Hill in Tallahassee. I don't get it. I don't get it. I don't understand. There's 10 other states that have laws with cameras. 10 other states. Where's my paper? I've got all kinds of stuff going on here. It's absolutely crazy. I don't know where it is right now in my paperwork, but in my delegation meeting video, I have to add in Nevada. I have to check New Jersey, but I know Nevada. I'm actually contacted, but it's Illinois, Texas, Rhode Island, Minnesota, Ohio, Oklahoma, Washington, Kansas, Louisiana, New Mexico, and Nevada for sure. I have to check New Jersey because someone said something the other day that made me doubt that I was correct. So I need to verify that. Fact check. But
Right.
5 years in a row, there's been a bill presented in Florida, 5 years that I researched. In 5 years, all 5 years, nobody on Capitol Hill is interested in co-sponsoring it. We're talking about no cost to the government. The responsibility lies totally with the family. We're talking about not everybody's going to have them. So the people that are abandoned in nursing homes are not going to have anybody watching after them. They're not going to even have a camera. Those people are going to be the worst victims of all. But it's just a law to give you the right to choose. And if you want to choose, then do it. But it's a camera. There's no cost.
I think that's fair because you have the option. Do you want it or not? You're not saying you have to have a camera, but it's allowing you to have that extra security. And I think that's important and that should be a right. And if you're worried about people posting this shit online, I'm sorry, then that's a criminal offense because you do not have the right.
Yeah, it's in the bill. There's penalty. there's penalties for people doing it. And it's lined out that you can't do this and you can't do that. You have to get roommate consent. And if the roommate doesn't want it, but you can't move rooms, then you have to angle the camera so that it doesn't interfere with the other patient. There's all kinds of things that are in the bill that advocate for everybody, the facility included. They need to be notified in writing. You need to post signage so everyone's aware. There's no surprises. There's no hidden camera. There's no gotcha. It's, hey, this person is being watched over by their loved ones. They're still being cared for from afar. They just need your help. And I had people look at cameras and talk to the camera and tell the family through the camera that the family needed more diapers. The stories that are coming out from what I'm hearing is great. But if the legislators don't hear these stories and they need to hear the nightmares, they need to hear the nightmares. And they also need to hear from employees who maybe have been falsely accused, maybe even lost their job over a false accusation, because I bet you anything they wish that the patient had had a camera to prove their innocence. The only people not wanting cameras are the people that don't want it seen on camera. And why? The legislators are saying that's okay with them. That's okay with them. What I found out is that this year they reduced the number of spots per bill. So like House of Representatives, we have Senate Bill 64 in the Senate side. We need a co-sponsor in the House side. And they only get 7 spots. They get 7 bills to submit. So that means yes, it's important. Let's just start what I'm getting ready to say. It's important. Water restoration, purification, hurricane recovery, child services. It's all very important. The problem is that water conservation and hurricane recovery are taking the place of elder protection, are taking priority over elder protection, which leads me to think legislators believe that elders are expendable, unimportant. They're going to die anyway soon. Why care? Who cares? They're not going to know what's happening to them. Who cares about any of it? When the legislators have family members that get raped, beaten, or neglected, I bet you there's a law. It's like the senator who drives down your street who's got potholes, your street's going to get paved. It's going to take, I don't know what it's going to take. I was going to say that it's going to take their family members experiencing this nightmare, but I don't know.
There's a lot of things legislators need to concentrate on that they refuse to look at. And it's frustrating because, us citizens, we see the issues that really need to be handled. And of course, they know it too. Deep down, they know it. There's just hidden agendas, I believe, across the board on why these certain things don't get done. There's always a hidden agenda.
Yeah. Someone told me that there's a few legislators that have their hands in the pocket of the insurance industry. And I know that's true. The problem is they're not seeing what could happen as a result of the cameras, the positive, improved healthcare, improved employee satisfaction. Employees could get rewarded by these. I was able to reward people that came into our house and took care of my parents because I was working full time. My adult children started to take care of my mom and dad, but then started having babies. So they were off and we had to hire people. They got rewarded for good care. Cameras will show families that person tried their hardest to get mom to take a bath, even though she hasn't had a bath in 3 weeks, because she doesn't know she needs a bath. Did you know dementia patients don't even know when they have a UTI? They don't recognize, they can't verbalize pain or irritation. They're lost. They're so lost. I'm so sorry for you. I'm sorry. My journey's behind me and yours is beginning. And I'm sorry.
Yeah, he's been lost a few times. So it's gotten really bad. And that's why I wonder, and I get scared, like, do we one day have to put him in a place? Because they had to hospitalize him because he got lost, and then he was fighting with people because he didn't know who they were. He doesn't know where he
He's afraid.
belongs.
He's afraid.
Right. And so he tried to jump out of a 5-story window at the hospital.
My
It took
mom
6
out of a
people.
moving car. Yeah.
Yeah, I mean, it's crazy what these diseases do to you. It's just mind-blowing, and it's so sad to watch. It's just so sad.
It is. And to think that legislators are okay with these people being left alone behind closed doors where people get frustrated. They want you to take a bath because you stink, but you still are fighting with them. These employees are working a tough job because you know what it's like to be a caretaker. You're working and taking care of someone. I was working, taking care of someone, and it's exhausting. Employees are the same way. Employees are exhausted and they need advocacy for them too. That's what cameras will do. And I don't know.
Totally agree with that 110% because cameras will help everybody. It's
Mhm.
not just for the patients, it's also for the workers. And that's
Mhm.
something they need to understand. So, what do you need done to help move this forward?
I need big voices, voices that have lots of followers, voices that have lots of influence to get everybody they know to email Florida senators and House of Representatives. And it's more important that the House of Representatives get these emails because they're the ones that aren't receiving it. I had one senator last year do this. He put his arms like this over his desk and he said, "I'm sorry, Miss Sifrit, I can't help you." And he's my representative. And I'm like, okay, my mom's raped by a stranger in a nursing home and you can't help me. Okay. All right. I'm moving on to somebody else then. So I need at least 900,000 people. And that's not a joke. In Florida, this is part of my investigation and self-teaching. In Florida, if you want to start a petition that is then submitted to the government to consider a bill, you need 900,000 verified voters' signatures. That means you need name and address of 900,000 people. Plausible. That's every Walmart and Publix and Winn-Dixie parking lot across the floor, up across the entire state, and I can't do it all. So I need voices, and I need big voices, people that are pissed off that senior citizens are not being taken care of in this state, that they are being left behind, that they are being considered expendable, and no need to protect them. We need the legislators, House of Representatives to have heart, and they don't see it. I don't know what to do about it. Why they see, that there needs to be a bill for something else that's going to cost the government money instead of a tiny little bill that's going to cost the government nothing but protect people.
Makes sense to me. But who am
And
I?
so that's the bad thing too, is there's so many people that are high-fiving me and had a girl pull down Rosie the Riveter, Gary, get little. I need voices. I need 900,000 people that are going to talk to Ben Albritton and Daniel Perez. Those are the two leaders in the House and the Senate. And those are the ones that need to be convinced. I went to the delegation meeting in Sarasota, Florida on December 16th. That's the video you saw. And I watched right there on the spot, Senator McFarland commend someone's presentation at the podium, not their presentation, but their topic. And she said, "Senator Nix, I'd like you to take this issue on and sponsor a bill." Right in front of my eyes, she told one of the senators to take this bill and sponsor it. That made me just absolutely melt. Because I've been at this for 4 years and people are telling me, "No, not important enough. No, not in this show. I want to take it. No, not in my wheelhouse," is what one person told me who worked for AHCA, American Healthcare Association. I said, "I need advocacy for elders and carers." He says, "It's not in my wheelhouse." So the Healthcare Association says that it's not in their wheelhouse to protect. And he's high up in this company. We need voices, people that are pissed off and won't quit. We need emails daily, frequently, every week, every month, phone calls. We need people showing up with signs to these delegation meetings. I need readers at these delegation meetings. Do you know what a delegation meeting is? Have you ever heard of one?
I've heard of it. I've never attended one.
I just found out. Here I'm at this thing for 4 years, and I just found out like December 1st or November 15th, if somewhere in there. They're captive audience, and they're a requirement by each district. So there is a requirement that the delegates, the senators and the legislators for a particular county have to sit and listen to the citizens of that county. So they're a captive audience. They have to listen. Now, when I presented in Sarasota, Fiona McFarland, smiled, nodded firmly. Yes, yes, yes. Senator Grudas, Senator Nix, they're not interested. I need people. I need people that are tired of it. We need to do something. I don't.
Do you have the email addresses and the phone numbers and all that?
I have a Word document, a 2-page Word document that lists 120, and all you have to do is copy it, put it right in an email, and blast. Yeah, I have that. I do. If anybody wants to contact me, the problem with me is I don't know how to. I only started social media as a result of trying to get this out because it wasn't working. I didn't have social media, and so I wasn't doing anything for the first 3 years. And someone said, you got to get on social media because I've been on the TV, I've been in the newspaper, but everybody keeps telling me that's archaic, that's old, that's outdated. No one's listening. So I started TikTok, Instagram, Twitter, or X or whatever it's called now. And I don't know how to work them too much. So I need people to contact me one way or another. And I will send them a script to read at delegation meetings, addresses, times. I've already signed up for, I don't know, probably 15 delegation meetings. And I know I can only do one a day pretty much. So
Do you have a running list, like where you're collecting the names? Do you have like a sheet or anything that you're using?
a sheet of names of what? Volunteers?
People for the 900,000 signatures you need.
Yeah, I have 2 people. The person that I'm talking about is Mary Ellen Lawler, L-A-L-O-R. She found saw my newspaper article last year and contacted them to contact somebody. And she got in touch with me. They gave her my number because I told them to. And so she and I spoke, and she's been with me since April. And we are, we got to do this, we got to do this. But she's about 3 years behind me in learning the legislative process. So she'll come up, and people on TikTok and Instagram, and they're doing the same thing. Well, do this and this and this and do that and get in touch with this and don't forget that. And I've done it all. I've done it. I've done so much in 4 years, contacting, sharing, notifying. So I don't know. I get off topic sometimes. Sorry. What's your question?
No, you're fine. If you could send that over to me,
The list?
I will see what I can get done on my end. Absolutely.
Thank you. On the spreadsheet of the Word document, you'll see all of the House of Representative names. Under that, I have a list of media. So all of the newspaper and stuff in my area. I need to get some stuff in Tallahassee. I actually need to do that at television station up in Tallahassee. If you know of anything, let me know. Because every email I'm sending to the senator or to the representatives, I'm copying all the media on. And I have the people that have already done articles on me, and not me at all. That it's not me, the issue. So I will send that to you, and you'll see how it's laid out. And it's even got that document has all the bills that have passed in other states. So I'll send it to you, and then you feel free to send it to whomever you want to send it to, and everybody you know. I don't know. I'm very
I'll help
disappointed.
collect signatures.
You what?
I'll help collect signatures.
Well, that's not gonna matter now because we have a bill written. A petition would get a bill written, and we don't need the petition. We have Senator Garcia of Miami, Elenia Garcia, female. She has written last year's bill and this year's bill, but not the year before. Travis Hudson did the one before that. And she used one of her slots to write the bill. But she can't find anybody in 120 people on the House side to say, okay, I'll tag team with you, girl. We got it. Nobody. And 120 people. But it's sad because it's not like I'm asking you to change the world. I'm not asking them to change policies that are going to negatively affect everybody. It's crazy.
Right. And you're still
Right.
leaving an option. So if people want to participate, they can, but you're not saying everyone has to have a camera. And that is the big thing here. Like, you're not saying, okay, from now on, everybody gets a camera. No, we just want the option to have a camera. And I think that's fair. That is a fair option to have.
I do too. It's just that senators and representatives don't want to use their fluff to vote on that.
Well, if somebody does want to get a hold of you, what is the best way?
My email address is mrssife@verizon.net. Mrs. Sife at verizon.net. Hopefully I won't have to, get a bunch of spam on that, but yeah, just hopefully. Like I said, I don't know social media too much, and now I'm putting myself out there, but we need to do something to advocate for the vulnerable people in this state because they are certainly not being advocated for. Not in the places without cameras. The places that have cameras, yeah, people are doing their best to try to take care of these people. Because it's unfortunate, and you're seeing it. It's the disease is a digression in age. It's a Benjamin Button situation. They are digressing back to infancy, and it comes down to diapers, wiping, brushing their teeth, feeding them, and having them throw temper tantrums because they don't want to take a shower or a bath or go to bed on time. It's infancy, and it's the saddest thing.
I agree. And I will try whatever I can to do to help you move this along because I totally agree with what you're doing.
Thank you. Thank you.
You're
We
so
need
welcome.
so many. We need Ben Albritton and Daniel Perez to buy in. It makes me.
I get it. It's frustrating, man, especially when it's something that's needed. Instead they worry sometimes about things that aren't top notch. Like, come on.
Yeah. Yeah.
Well, I want to
Anywho.
thank you so much for being here and sharing your story.
Thank you for offering to do this for me and to help me get my story out because we need, and again, it's not my story. It's the story of the need to protect vulnerable people in the state of Florida. We've got to have the undeniable right to install a camera in a nursing home room or a long-term healthcare facility if we so choose.
Correct.
Yep.
I agree.
Thank
Okay.
you. Thank
You're
you so much.
welcome.